what makes one health system more ready than another to move to the cloud?
I don't think we've ever talked about this, right? And at least the simplicity of it, right? I think the context is organic growth versus, measured growth. On that, most health systems that I've seen have grown organically. Like, I'm going to buy this system or that system or that system, and just keep adding on to the Band-Aid ball. But as opposed to, logical and methodical growth. We know we're going to grow by a factor of X year over year, and we're going to plan for it. And I think that's kind of really at the epicenter of why, from what I've seen. Because coming from other industries, we've done that. It's coming into healthcare. I've yet to see that logically thought through.
Yeah, I think the other thing we've noticed is that some health systems still don't have a handle on the basics, on the basics of blocking and tackling. So when we go in there, like for example, when I came in as CIO, I asked, okay, I would like a list of all the organizations that we're connected to and what data we're sharing. That took almost 6 months to a year for me to get that list. So organizations that have trouble with the basics of, hey, can we have access to this data, this information? Do you know where your contracts are? Those organizations need to, not that it's an insurmountable hurdle, because we got through it. And, but, being able to have access to that data, even though it's, a lot of times we can just take raw data and process it. Just knowing where it is and having access is one of the things. So, what are some other things you found in terms of organizations being ready?
I think process maturity is a key, right? So standardization, and this is not process for process sake, is do you have standard repeatable processes that a large portion of your staff follow? And in a lot of cases, it doesn't exist. And that's the baseline for building blocks of automation and kind of growth from that. So, building on what you said, like asset management is one key, but do I have standardized procedures for patch and reboot or change or things like that? So if it's measured and applied consistently across a larger part of the organization, you're much more mature and ready to take those leads rather than you have to set those building blocks into place first.